Moving now into resisted range of motion of the knee, leg, ankle, and foot, and you'll note we begin with our client face down. We would have just completed our passive range of motion, in which we started in a supine position and then flipped them into a prone position at the end of passive range of motion, so we will continue with our client in a prone position. Noting that we do our very best to have our client flip as few times as possible during an assessment. If, say, for example, they have hip pain and we flip them 5 or 6 times, it's very uncomfortable. So, moving now into our resisted motion. To begin with, we're going to bring the knee we are testing into a slightly flexed position. I prefer somewhere around 45 degrees and no more, maybe less. Certainly, you will never go into 90 degrees. In fact, I would encourage you to never even approach 90 degrees. The reason being, if we apply resisted contraction of the hamstrings and we're approaching 90 degrees, there's a high likelihood of causing a cramp in the hamstrings. So again, backing off to somewhere between 30 and 40 degrees. To start with, I'll get you to hold your leg in that position. That's comfortable, right? Good. And if they say it's comfortable, we know that we can now move into our true resisted range of motion. As we know with resisted range of motion, you will hold it for a full 10 seconds. So, I will get you to bring your heel towards your bum, pressing into my hand. Good. And we'll just hold that for a 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and relax. Good. Bring that leg down. So as I say relax, I'm making sure to hold on to the foot. If I simply say relax or I let go before I say relax, she might end up bringing her leg up or there will be a cramp. So we communicate clearly what we want them to do and make sure we support them through the entirety of that motion. The next motion I'm going to work on now is extension of the knee. So the same thing, bringing that knee into about 45 degrees. You can hold it there, that's okay. Good. Now I'll wrap my hands around the ankle and I want you to try and straighten your leg, please. So we will hold that for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and relax. Good. Excellent. All right, so now you've seen me do a resisted range of motion test, counting through the full 10 seconds. For the remainder of the demonstration, though, I'm simply going to say 1, 2, 10, because I'm sure you don't want to hear me count from 10 to 1 many times over. But note that when you perform this, do not get in the habit of simply saying 1, 2, 10 or holding it for a short period of time. It really is essential to hold it for the entirety of those 10 seconds. Moving now into plantar flexion of the ankle. So we bring the knee into 90 degrees of flexion, and I will then firmly grip the calcaneus, bring the ankle to about 90 degrees. You then take your entire body weight, as much of it as you can, and you apply pressure down into the ankle. And what I would like you to do, please, is push into my arm and meet my resistance. Okay? Good. And we will count from 1, 2, 10. Relax. Good. Now the reason I said push into my arm and meet my resistance is in this motion, there is virtually nothing I can do to overcome the strength of the plantar flexors of the ankle. Most people are able to plantar flex with an extraordinary amount of strength, and it's really hard to resist plantar flexion of the ankle. So make sure they meet your resistance and only apply as much force as you can comfortably do. So we did resisted range of motion with the knee in 90 degrees of flexion, and that primarily assesses the soleus. Now, let's work on the gastroc, and I will move to the other leg simply for the sake of this demonstration. So with this other leg, we will then bring it off the side of the table. Once it's off the side of the table, I will then take my leg and apply pressure into the foot to create dorsiflexion of the ankle. And then my hands will apply gentle pressure to stabilize the leg, and I'll ask you now to simply push into my leg. Good, and we will count from 1, 2, 10, relax. And then we'll take the leg back up onto the table. Now we've done resisted range of motion as far as we can take it with our client in a prone position. So I'll get you roll over face up for me one more time, please, and thank you. Excellent. Moving now into the remainder of the range of motion of the ankle. We'll move into resisted dorsiflexion, standing at the bottom of the table. Bring the foot into a dorsiflex position, and I'll take both of my hands on the top of the foot. What I'd like you to do, please, is bring your foot up like this, good, and pull into my hand and meet my resistance, and then I will lean back. We'll count 1, 2, 10, relax. Excellent. In the same position, standing at the bottom of the table, we will do inversion and eversion. Keeping my hands in this exact same spot, we can do both, so I'll firmly grip onto the ankle, and what I will get you to do is roll your ankle in, please. Go ahead, roll it in for 1, 2, 10, relax, good. And now roll it out, please, for 1, 2, 10, relax, excellent. The last thing we need to work on then is the toes. So using the palm of my hand, I'll bring the toes into a slightly extended position, and I'll get you to curl your toes into my hand for 1, 2, 10, relax, good. And now I want you to just extend those toes, try and open those toes up, 1, 2, 10, relax, excellent. So we have now gone through resisted range of motion for all of the motions of the knee, leg, ankle, and foot. However, I do want to demonstrate that we can also do resisted range of motion of the knee in a supine position. We simply take the knee into a flexed position, and to do extension of the knee, I will then sit gently on my client's foot, stabilize the knee, and if you will, try and straighten your leg as much as possible. Good. 1, 2, 10, relax. Good. And bringing that knee into slightly more extension, not wanting to get near 90 degrees. I'll get you to try and bring your heel towards your bum and just meet my resistance. 1, 2, 10, relax. Excellent. If at any point in time your client experiences anything even approaching a cramp, stop the test. And of course, with resisted range of motion, pain indicates dysfunction to the contractile tissues. Hey, thanks for watching, and don't forget to subscribe. If you would like to learn more about orthopedic assessment, click the link in the description below and register for a free training on orthopedic assessment, where I'll take you through my entire assessment process beginning to end, step by step, and teach you my 3 secrets to get more out of every session with my clients. I'll see you there.